Today we're going to be talking about adaptogens, which are just amazingly powerful herbal medicines. And we feel like this is a great time of the year to talk about these because anything that's going to help with stress management and vitality can make a big difference this time of year. So I'm Dr. Molly Force. I'm the clinical director here at Prosper Natural Health, which is a wellness center in Port Townsend. And I'm joined by Dr. Rosalie, who's here with me. And we are naturopathic physicians. And that is a little different than a conventional physician in that we really like to look at the whole picture as far as what it is that we're trying to treat in regards to different organ systems that might be involved, and then use natural medicines as a primary source of healing first before we use other interventions, other higher level interventions like pharmaceuticals or surgeries, for example. So one of the things that we've been doing for the last several years is sharing information about questions that we have come up in clinic. And we've started doing these monthly talks, these doc talks, and we're going to continue them into 2025, but they'll be pre-recorded for you guys. And so it should be really easy for you to access those, and they'll be released monthly on our website. You can go on currently to our website, and we have a big archive of the last several years and the doc talks with all kinds of different health topics in regards to questions we've answered and really neat literature that we've shared, scientific literature that we shared. So make sure not to miss that. Check that website out. And we're going to jump into talking about adaptogens. So one of the first things we want to do today is make sure that we really define what this class of herbs does and why we want to actually pay attention to them, what kind of benefits they can provide for people. And we want you guys to kind of come away from this having a new set of tools, maybe, or a broader understanding of this adaptogenic set of tools. And these herbs are often used in both Western and Eastern medicine. And we're going to see these really, once again, used all over the world in traditional medicines. And there's a lot of really cool literature and research that's actually been done and funded for these. And a lot of these started out as very traditional remedies that were used by wise healers and have now kind of morphed into our understanding of what it is that these cool phytochemicals provide for us and how they affect our bodies.
So, what do herbal adaptogens do ultimately? This is such a fancy word, but do we really know what it truly means? So, what they do is the word in there is adapt, which basically helps the body's ability to adapt to physical stressors or life stressors, both mental and physical, internal or external. So, these adaptogens are herbs with constituents that help with the body's stress response symptoms. So, what it can do is modulate the stress hormones, and most specifically, we look at cortisol modulation as well as adrenaline modulation. Remember, adrenaline is epinephrine. When there's something scary, it's the big neurotransmitter that gets released. What these adaptogens can do, especially over a longer period of time, is they help develop resilience, right? The body's resilience to stress, again, whether it's physical or emotional stress, internal or external stressors. So here's a list of our common herbal adaptogens. So if you do a quick search of adaptogens, you'll get a whole big list, such as this one. A lot of these come from the traditional Chinese or Ayurvedic medicines. We think pretty commonly of ashwagandha, but cordyceps is on there as well. It's a type of mushroom. Mushrooms are typically get used for a whole lot of things, but adaptogenic properties is one of them. Licorice is a big player, as is maca and ginseng. If you've heard of any of these are within the realm of the herbal adaptogens. So, the kinds of stressors that the body experiences are physical, whether it's a fall, an actual trauma, whether it's lack of sleep, lack of exercise, and sedentary lifestyle, whether it's repetitive movements that are not ergonomically friendly, right? The most common one I see is just sitting at a desk all day, kind of hunched forward. And then also poor food quality. All these are physical stressors to the body. Environmental stressors are multiple. They could be from our food systems, whether it's pesticides, insecticides, fungicides. They could be from your personal care products, and could also be from electromagnetic fields, any of the non-visual wavelengths that are hitting us. These could all also be stressors. Certain bodies feel especially sensitive to these, other bodies less so. Artificial light, again, it's not a full light spectrum, and that's stressful for the body. Water quality, air quality, another big one. We are so gifted in this region of the world in the Pacific Northwest with this just wonderful air quality. But that's not true at all in a lot of parts of the world. Psychological stress, also huge, especially when it's paired with these other physical stressors or environmental stressors. Toxic relationships, whether it's from the workplace, the home realm, the familial realm. Finances are also a psychological stress. And addition to that is kind of mindset and life purpose, kind of existential angst can really, really, truly lead to psychological stress. So now that we've got this example of all these stressors, now we've got to think about it from a biochemical perspective. And what we can sort of hone this into is what's known as the HPA axis. This is an acronym for the hypothalamic pituitary adrenal axis. Basically, this is the body's primary system for the stress response. So a message gets sent from one part of the brain, the hypothalamus, when it's exposed to a stressor. That hypothalamus sends another message to another part of the brain, the pituitary gland, which then continues the message downstream to the adrenal glands. And those live in the body on top of the kidneys. When the adrenal glands get this message, they release the stress hormones, okay, cortisol and adrenaline, and these start the process of the stress response. So imagine seeing a big scary dog. All of a sudden, message from the brain to the other part of the brain to the adrenals sends out these hormones, and your pupils dilate. You have increased blood flow to your muscles in case you have to run away. Your blood pressure increases. You're super alert. Blood sugar increases. Again, we're trying to feed those muscles if you have to run away. And your digestion decreases. So this is all kind of what happens in the milieu of additional cortisol and epinephrine.
So when we have this initial stress response, we consider that this acute stress, and that's part of this alarm stage. And this is just a little pictograph of kind of how this happens. And we have these releases of these neurochemicals and these steroid chemicals like the cortisol, norepinephrine, epinephrine, for example. And we get this release from the adrenal glands, as Dr. Rosalie was explaining, having that release from the brain signaling down and that HPA axis. And then what happens is if that stress continues, we start to get into what we call this resistance stage, where more and more of these chemicals are being released and the body's cellular receptors start to downregulate. So there's more that need to be released to get that body up into that stress response, which it's feeling like it needs to be to survive. And then what happens over a period of time is there becomes this exhaustion phase as less of these biochemicals are able to be produced by the adrenals as they begin to run out of cofactors and building blocks to be able to do that, as well as these receptor sites down regulating. So when we get into this zone of chronic stress, we see a much different lab profile for people, and that means different chemical reactivity for their body. So chronic stress, which is what a lot of us find ourselves in our society, is really looking at this elevated cortisol level in particular that occurs over a longer period of time. And we have very specific illnesses and pathologies that really start to crop up whenever we have chronic exposure to these stress hormones. So we know that blood sugar dysregulation is one of those, and that's because cortisol is a glucocorticoid and it affects how our insulin is maintained by the body. So that puts us at higher risk of things like diabetes and blood sugar control management problems. Weight gain, we know, comes along with that. Once again, cortisol is going to increase weight typically for people, as well as fluid retention for what it's trying to do to be able to protect the body. It ends up being a long-term side effect of it. We see our immune system slump once cortisol has been exposed for long periods of time too. And this is very well established in the scientific literature as well. And then mood disorders, so higher chances and higher reports of anxiety and depression in particular whenever there's excess cortisol for long periods of time. We also see dysregulation with blood pressure, and that has to do with how the cortisol affects our electrolytes and our blood vessel dilation, as well as the kidney function. So we can have too low of blood pressure after a long period of time, whereas in the initial phase of stress, we get that really high blood pressure a lot of times as an initial reaction. And then we also can see things like infertility, the body not able to want to be in a more vulnerable state with being fertile when it's assessing or seeing chronic stress. And a lot of times that's linked to less of our sex hormones being created and more of these adrenal hormones related to stress management being related. So some of the common symptoms that we think about when we think of stress or everything more acutely, like immediately, like the sleep disturbances, and maybe having, poor concentration because you're not able to access that frontal lobe to do more decisive thinking. But then we also start to get into some of these chronic symptoms where we start to see hormonal imbalances and fatigue and weight imbalances for some people, lack of drive because their mood and their other neurochemicals like serotonin and dopamine become impacted from this, and then a weaker response to the immune system. So the important kind of takeaway here when we're thinking about stress and we're thinking about tools for managing it, whether it be a mental, emotional, internal stress or an external stress, when you think about things like adaptogens, we want to be thinking, are we in an acute stress or are we in a prolonged chronic stress state? Because these are going to lead to two different sets of current symptoms and body reactions. What's cool about adaptogens is they can be helpful in both scenarios. It's one of the most amazing things at looking at some of this literature is like, wow, how phenomenal that there are these tools that truly help the body adapt and regulate to wherever it needs the support the most.
So, how do we really know where our cortisol is? Remember, cortisol is that stress hormone. Are you in the early phase of the stress response, or are you more in the burnout phase? So, there are labs that can help us figure out where exactly we are in terms of the stress response. So there's a couple ways we can get this information about cortisol. We could gather it from a blood test, we could do a salivary test, we can do a urine test. What commonly ends up getting used, especially in our practice, is a salivary test. The reason for it is because if we go to the next slide, you'll see what cortisol looks like throughout the day. And cortisol has very specific surges within 30 minutes of waking, all the way on that bottom graph, you'll see within 30 minutes of waking, there's a spike. That's the highest spike throughout the day. That's what's known as your cortisol awakening response. So the reason we use salivary testing is so that you don't have to come into the clinic 6 times to get a sense for your cortisol curve. It's a lot easier to get this data from a salivary sample than it is to try to come in at very specific times to a clinic where someone can draw your blood. That said, what's really important with these salivary tests is that we get one data point at the very least, which within 30 minutes of waking. Another data point around noon, midday. As you can see, the cortisol curve really plummets at that point and starts to plateau throughout the second part of the day. We get another data point around dinner, another data point before bed. So that first graph on the left is what a normal curve looks like with someone who has a normal cortisol response. They experience stress. They sort of have a cortisol response, but the body cycles through it with ease, and we sort of see this regular diurnal circadian rhythm happen. With someone experiencing chronic stress, for example, my patients who have a really demanding work schedule or familial schedule, they have a family member who's suddenly very sick, they're having to be kind of on the clock all the time. We still see a cortisol awakening response that's robust, but we don't see that decline throughout the day, which means that cortisol is remaining elevated in the nighttime hours when it should be declining. When cortisol remains elevated, our hormone melatonin doesn't have the opportunity to surpass it at night. Thus, we start to see sleep disturbances. So chronically elevated cortisol tells me there's also an issue with the melatonin pathway, right? So if you are in this state, you've probably tried melatonin, but realized that doesn't work for me, right? And it's because your cortisol is still so elevated before going to sleep. This type of pattern leads to a whole bunch of insomnia, whether it's waking every 2-3 hours or waking once in the night for 2 to 3 hours at a time. So that's kind of what we see with this chronic stress, chronically elevated cortisol response. When we're sort of beyond that phase into the burnout phase, where that stressors, those life stressors have happened for a prolonged amount of time, the feedback loop that the body gives from the adrenals to the brain again, that says we've seen way too much cortisol for way too long, that feedback loop ends up creating a diminished cortisol, like a burnout response. So all of a sudden, that cortisol awakening response, that first data point that's supposed to be nice and robust and elevated, is just a little blip. And the rest of the day looks kind of plateaued in terms of cortisol response. These are my types of patients who have a very hard time getting up and out of bed in the morning. Could kind of nap on all day, but are also sleepless all night, right? When we don't have that nice up and down of cortisol, the body doesn't quite know where to situate itself. So what I end up doing with patients, I actually opt for a 6-point cortisol curve because I truly want to see what that first cortisol awakening response looks like. There's such variability in those first 60 minutes of the day that I end up running this 6-point test with my patients, especially when I'm concerned about chronic stress and especially when there is a big insomnia picture on the other side.
So let's jump into some information about adaptogens and the cool research that's been coming out over the last few years and how that's going to relate to our stress, whether it be acute or chronic stress. Now, we always love to find these very robust scientific studies that are doing things like looking at meta-analyses, which means they're taking into consideration multiple different studies. And this one that we came across that just came out in 2023 was really cool because it's not just a meta-analysis taking in a whole bunch of data sets, but it's also looking specifically at randomized controlled trials. So randomized controlled trials are kind of like our gold standard when we're talking about scientific method for making sure that we've got some really good validity for our research that we're doing. So this is really cool because it's looking at these very robust data sets that should be pretty darn accurate for us. And the question was here, when they reviewed these adaptogens, were these adaptogenic plants actually helping with stress or not? So what the authors did is they defined what a stressor was, and they really used cortisol levels in order to do that, to be able to provide a number that correlates with stress, because that's one of the easiest markers, as we've just shared with you guys, as far as understanding what the body is perceiving as stress, once again, whether it's internal or external. And this study was looking at studies that looked at least 56 to 60 days of treatment with these herbs. So we want to give these adaptogens long enough to go in and affect this communication from the brain down to those adrenal glands, so that HPA access. And then they pulled out a specific herb that they really talked a lot about in this study, which was Withania somnifera, which is our fancy way of Latin name for ashwagandha. So many of you have either used or know about ashwagandha as an herb. It's touted to be generally pretty darn safe as far as risk benefit ratio. It's considered to have fairly low side effect risk, which is pretty fantastic. Although I will say, out of our nightshades, out of our adaptogens, it is a nightshade. So that is critical to be thinking about for folks that have nightshade intolerance. So this one was showing that when we look at these stress scales and cortisol levels, ashwagandha is very effective for reducing stress. And you can see the dosing there that was used. It was between 240 and 600 milligrams daily of ashwagandha that was given in these studies that were compiled and assessed. So that's some pretty strong information for us that, gosh, these are powerful herbs, and especially ashwagandha is going to have a very positive effect for modulating stress levels for people as long as they have at least 2 months of consistently being on it.
So adaptogens also get used in treating depression. And what I really loved about this study here from 2023 was that it was looking at adaptogens, 3 particular ones. It looked at hypericum, which is St. John's wort, crocus sativa, which is saffron, and rhodiola. It looked at those 3 as a way of defining whether these could be adequate non-pharmacologic strategies, treatment strategies for treating depression. So it's pretty cool, kind of a head-on look at whether these herbs can replace pharmaceuticals. So in this study, it describes kind of depression as a sort of neuroinflammatory state. Basically, the brain is not able to work through things like a normal brain is, and thus there's a sort of an inflammatory load. What this research found was that yes, St. John's wort and yes, saffron were both seen to have clinical significance in terms of helping with depression symptoms. Rhodiola, on the other hand, was not seen to be clinically significant. So at least two of these three herbs were kind of defined as like, yes, we can use these as a non-pharmacologic therapy for our patients with depression. The doses being used of St. John's worts are very similar to the doses I give to patients in office, 600 to 1200 milligrams a day, with saffron or crocus sativa at around 22 to 28 milligrams a day for a duration that differed amongst the different studies here within this systemic analysis. But the duration was at least 4 weeks, which even with the pharmacologic therapy, I give patients around 2 weeks to try to see some changes. So this kind of matches right alongside that. What I like in this image here on the right-hand side is that there's a proposed mechanism for how this works. What these adaptogens are said to do is that they increase BDNF. BDNF is brain-derived neurotrophic factor. Okay, just a fancy word that means this molecule supports the growth, the maturation, the survival of nerve cells, helps regulate basically the brain activity. When we have low BDNF, we start to see neuroinflammatory symptoms, whether it's linked with depression or whether it's linked with things like Alzheimer's or Parkinson's disease. So how cool that we're kind of looking into the nitty-gritty biochemical here with this study, saying that, okay, indeed, we are seeing this brain supportive factor increasing when we have adaptogens on board.
So a next step that researchers have taken now that they're starting to understand that there's some kind of anti-inflammatory effect of these adaptogens is we see this study that came out here in 2024, just a year, really just a few months between the one that Dr. Rosalie just showed you. And here we're seeing researchers saying, hey, if there are anti-inflammatory effects from some of these adaptogenic herbs, can we figure out which signaling pathways that they're modulating? And does that also implicate that there might be neural inflammation that we can modulate? So for the brain and for the nervous system, can we also see anti-inflammatory effects? And really the category that we see these researchers talk about the most are especially with cognitive issues that come up from neural inflammation. So that puts us in the Alzheimer's category and the Parkinson's category in particular that these researchers were talking about in this study. So this is super cool because they're saying actually these adaptogens, and they were looking specifically at Schisandra, they were looking at Eleutherococcus, and they were also looking at ashwagandha. You'll see at the end that withania. And they're saying with these adaptogenic herbs, they're actually modulating our genes that turn on and off pro-inflammatory cytokines, and this is a huge deal for the body. So these are our prostaglandins and our leukotrienes. Those might be familiar words for you guys, especially post COVID epidemic. These are our inflammatory cytokines, okay? The signaling molecules for the body. And then they also modulate an entire signaling pathway that affects inflammation called NF-kappa B. It's a very well-established pathway. So this makes these set of herbs so much more powerful than what we even imagined them to do in regards to just modulating stress, managing stress. Well, this has such a big impact on the body to reduce the stress through the cellular level of reducing inflammation. And so what these researchers are saying is that there may be clinical implication here and use of these type of herbs for people who have neurodegeneration because of inflammation that's happening to their neurology. So that's, once again, they were talking about specifically Alzheimer's and Parkinson's patients, but I would wager as a clinician and somebody who really tries to study the physiology of how these things can affect the body, when I think about neuroinflammation, I'm thinking about anything from a TBI, where you have a traumatic brain injury that might be in sports, that might be in some kind of motor vehicle crash or something like that. Anytime we have that brain injury that can start the glial cells in this pro-inflammatory response, producing these cytokines. And that's exactly what they're talking about in this study, is calming down those glial cells, calming down those cytokines that are doing continued damage to the brain. So it's pretty amazing stuff in regards to cognitive protection, in my belief.
So this article here, this research article, is about a nutraceutical, sort of an extract from herbs called phosphatidylserine. This is kind of has for the last couple of years been sort of increasing in the sort of pop culture. I've been hearing a lot about it. And phosphatidylserine is used to be derived from cow brain, and now is kind of derived from a soy source, soy lecithin. Otherwise, in any other sort of fat-containing foods, such as like fish or organ meats, will also contain phosphatidylserine in it. But what this one was looking at, and the way I use this one clinically, is for specifically cortisol regulation with my patients who are in that kind of elevated phase, that first phase of chronic stress, where you imagine their cortisol curve remains really, really high. So phosphatidylserine is in this study has been clinically significant in terms of reducing the production of cortisol and slowing down the activation of that HPA axis, especially when described within the context of MDD, or major depressive disorder. So it helps alleviate this HPA axis upregulation in that first level of chronic stress. I've used this clinically with a lot of success for my patients who have that morning wake up time where they're up at 4 a.m. and cannot seem to go back to sleep. I'll dose phosphatidylserine the night before at bedtime for this specific cortisol management piece.
So now we have this good understanding that adaptogens help with stress. They help with fatigue. They can help with mood. But we also see in the medical literature here, just in 2023, this really great example of how adaptogens can help with our actual endurance and muscle strength. And this has broader implications, even to helping with sexual dysfunction. Okay, so we're thinking here physical stamina and muscular strength, and reducing impairments in the body in regards to modulating stress and being more effective when it's under these stressors by the body that could even just be as simple as exercise. Okay, because exercise is this beautiful thing that's helpful for us, but by the body sees it as these stress and repair cycles, right? So every time we're contracting our muscles and enduring weight on those muscles, we're having these micro tears, which also then signals the body to rebuild and build stronger, okay? We also see this impacting, once again, though, the brain and concentration. So it's this two-way street of the physical with muscles and endurance, and then also with concentration and mental acuity. So pretty fantastic. And what we really loved about this study is they did a great job of breaking down 8 of the top adaptogens specifically for improving athletic ability. Okay, so they even ranked them for us, and it's pretty cool because they give the common name, which a lot of us know these herbs by, as well as the biologic or Latin name, we'll call it. and then the action for what they are known to be good for, according to the research, and then things to watch out for in regards to common side effects that have been reported. So just some highlights here. Ashwagandha's kind of top build here, and remember that's that lovely Ayurvedic herb that is a nightshade, but very powerful. And we see that this one can really improve specifically that muscle strength and endurance and a person's perception of quality of life. That's pretty deep stuff right there. We do see that, especially with high doses, there could be the potential of constipation or reduced appetite with it and runny nose, right? Rhinitis for some people. Astragalus is the second one that they went over here. And we also see this improved muscle recovery and endurance with this. What's cool about astragalus, different than ashwagandha, is it's a very well-known immune modulator as well. And so we do know that there's some types of autoimmunity in which it's not appropriate. And that's something you should really talk to your medical provider about before starting it. Cordyceps, you guys have probably heard of this form of medicinal mushroom. It has been shown to help also with improving endurance and energy. And we know that it might have some side effects for some people of things like nausea, diarrhea, and dry mouth. I've never seen those. I don't know if you have, Dr. Rosalie. I certainly have it. So it would have to be pretty high doses, I think, to get there, or somebody who just happens to have a sensitivity. And it is important to realize that everyone's unique. Not everyone's going to metabolize things the same way. So it's important to listen to your body if something's not feeling right. Ginseng is also talked about here. And we see once again, and this is such a well-known herb in Eastern medicine, used for that muscle endurance and strength as well as recovery. And we also think about that one as helping with energy and fatigue. Holy basil, some of you might know that as Tulsi. It's become kind of popularized in the herbal tea world, and that one can be very helpful for muscle recovery as well. We see that one potentially causing mild nausea, but once again, I've absolutely never seen that for that herb. It's so interesting. I think of it as such a gentle herb. And then rhodiola, very famous adaptogen as well. We know that that from the study increases this physical endurance and strength, and it does have a few side effects for that one. And I have seen, I'd say about 1 in 10 people don't do as well on rhodiola, but generally I'd consider it a fairly safe herb, but it does have some, literature that says that it can produce this, things like dizziness and dry mouth. And so really important, or a lot of salivation. So really important to pay attention to how your body feels when you start something like that. Schisandra is this really beautiful bright red berry that is from Chinese, traditional Chinese medicine, or Eastern traditional medicines. And we see that this one can also help with the muscle strength and endurance and help once again with that overall physical performance. We got to be careful with that one because it can affect some of our liver clearance pathways. So it's just something to pay attention to. And then the final herb that they list here is actually turmeric. And some of you might not think about turmeric as an adaptogen, but it actually is. And we know that it's a very strong inflammatory modulator as well and works on that COX-2 pathway, which affects our inflammation. And this can also help with muscle recovery. So in some cases, we see it being causing some GI irritation for some people, and at high dose, we worry about it potentially being a blood thinner. So those are kind of the things to watch out for with some of these herbs, but just great examples of how many of them have certain strengths that they can provide, and how cool to have something support us physically with muscle endurance.
So you're probably wondering, you're probably getting excited about adaptogens just like we are, and wondering where to start, if you want to add some adaptogens to your current regimen. And so, sorry, excuse me. The way that these have been dosed in the Eastern world has been predominantly as a a like ground up herbal form or as a tea. And so sometimes with some of my patients who I'm doing a more Ayurvedic regimen for, I'll give them a ground up variety of the herbs. But what's probably more sort of palatable to the Western palate are these more encapsulated forms of the whole herbs. And so we can find those pretty easily through our online dispensary or here in office in our apothecary. We do have a series of online stores that are physician grade apothecaries that kind of basically combine the supplements and nutraceuticals that have been vouched for in terms of quality. So a safer place to get your supplements if you truly want to know where they come from. We are having a 10% discount in the month of December on our online apothecary and in-store this year. So some of the adaptogens we have here in office in our apothecary are, either single herbs, whether it's in pill form, whether it's as a tea or a tincture form, we can find those fairly easily. What's more, what I usually start folks on are combination products. And so remember, adaptogens kind of have two different flavors. There's our more upper adaptogens that are more activating, energy providing, and there's our more like regulating, anti-anxiety type adaptogens, right? So our botanical herbs that are just herbs only, that are these combination products, I'll sort of cater based on the symptom picture, right? So we've got one called HB8 Adapt, Cortisol Manager, Cort Align. All of these are just a combination of some of these adaptogens. Some are the more upper energy providing ones. Some of these are more of the, we'll say downer or like anxiety smoothing ones. There's otherwise nutraceuticals, which are, have the addition of kind of some vitamins in there or that aren't just herbs. And again, here's our phosphatidylserine that comes back pretty strong, as well as another blend, adaptocrine, adrenotone. Both of these have additional B vitamins or vitamin C in there to kind of help with the other pathways. Lastly, I reached for what are known as glandular adaptogens, which have these herbs within them, but also have ground up adrenal glands, usually from a bovine or a porcine source, to help ultimately get, the adrenals, provide them with the building blocks, the very specific building blocks for making healthy adrenal response. So glandulars are not something that I recommend folks start on their own. I definitely recommend you talk to a physician about starting a glandular product. It's kind of similar to starting like a glandular thyroid product, right? There's medications out there that are glandular, porcine, bovine sources of thyroid medicine. This is kind of a similar, akin to that, but from the adrenal world. Hasn't been sort of cleared as being part of like a prescriptions, but ends up being at our disposal if we do choose to reach for these.
So when it comes to adaptogens, we always want to just remind our patients it's important to assess your stress levels and assess what might be fueling those stimulants, those things that are awakening stress inside of us, and try to address those at the same time that we are supporting the body potentially. So if we are wanting to reach for adaptogens, which definitely have a lot of great research and really good oomph to them and can be really phenomenal, We also always want to be trying to figure out what that cause is of the stress. If we can modulate that, sometimes we can't, but if we can, we want to be doing our best to lessen that stress while we're increasing our body's internal vitality and resilience, right? It's all about resilience. So we always want to just remind people that, and it's not just, grab an herb and it'll save the day sort of thing, although these herbs are very near and dear to our heart and are great tools for our toolkit. We want to invite you guys to our Duck Talk next in January next month. We're going to be releasing those still on the second Thursday of every month. This one's going to be specifically on eating for autoimmunity. We really wanted to look at some of the new literature that's coming out about autoimmunity and how diet can actually be impacting that, and refine some of the recommendations that we've made over the years for patients. And autoimmunity is really such a broad reaching piece at this point. It's not just folks that might have something like MS. We're talking about potential thyroid issues with Hashimoto's, or even psoriasis. Rosacea is considered a type of autoimmunity. So there are some of these other autoimmune pieces that people might be dealing with and not even realize, because they might not, have a diagnosis like Crohn's or ulcerative colitis or something like that. So we want to talk about the immune system and talk about how we can support that with foods. So please, keep an eye out for that. And then we want to also invite you, if you have questions with either adaptogens and how to get those started or how to dose those for you in particular, or if you want to get cortisol testing or look at some adrenal markers, we're here to help. You can check us out at prospernaturalhealth.com or give us a call and get a consultation booked. We want to also just open this up and make sure any questions are answered today. So if you guys have any questions, feel free to put those into the chat, and we're happy to answer those. We know we shared a lot of info. So Dr. Rosalie, did you have anything else to add?
Um, No, that just sums it up. I think, what I love about these doc talks while you guys are typing in your questions is just it's such an excellent way for Dr. Molly and myself to dive into the primary literature, the recent literature, and kind of keep our brains up to date on this, centuries old type medicine, especially with the herbs. So we kind of we get really excited to nerd out about this with you guys.
Yeah, it was really fun for me, after using these herbs for, 20 plus years now at this point with patients. It's like, this is pretty amazing that we're now finally understanding that there's an anti-inflammatory effect with a lot of these, and actually understand the cellular process of how this works. So it's just so wonderful. So, okay, let's see. Yay. Oh, we're so happy it's helpful. Yeah, the neural inflammation piece and the generalized inflammation information is just so cool, because it has an impact not just for neurology and these pieces that can pass blood-brain barrier there, but also when we're talking about like our long COVID patients, our patients with viral or autoimmune issues where inflammation has been really triggered. So it has some really cool broad implications. All right, you guys, we're going to sign off. We hope you have a good end of the year and holiday, and we're looking forward to seeing you guys in the new year, and hope everyone is well. Thank you for joining us.